On this Sunday night, Ontario's 28-day lockdown. The province's tough measures to get COVID-19 numbers down.
We will see, in all likelihood, a moment of historic difficulty in the month of January.
The circuit breaker and its impact on schools and businesses. A new strain of the virus forces European countries to ban UK travel.
The new variant is out of control and we need to bring it under control.
Will Canada follow suit? A First Nations community returns home.
It's not clean enough to drink.
Why a water advisory is still in place. And the breakdancing breakout. The new sport at the 2024 Olympics.
Global National with Robin Gill.
Good evening and thank you for joining us. Global News has learned Ontario will implement sweeping measures that will put that province into a lockdown for almost a month. And here's why. Today, Ontario reported more than 2,300 new infections and 25 more deaths. It's the sixth consecutive day the province has registered more than 2,000 new cases. The caseload is putting pressure on hospitals. And as Morganne Campbell reports, the Ontario government hopes this circuit breaker will break the chain of transmission.
This holiday rush at the mall may be the last indoor gathering in Ontario for now, and it is as if people in this province expect it.
Put it this way, it's our fault for not follow what they're asking.
Global News has learned Ontario will be completely locked down for 28 days come Christmas Eve. Sources close to the Premier's office say the only exception will be in northern communities, which will be placed under a 14-day lockdown period. The move comes at a time the province grapples with record high new cases of the novel coronavirus.
What we're seeing is all over the world, leaders are now sort of rethinking the Christmas holiday and how we're going to position ourselves for it. They may have reasons for their secrecy, but look, I'm going to say this, the lack of transparency erodes trust.
There will be an impact on schools come the new year. Elementary students will not return to class, but will spend the first week of school in learning from home. High schools will remain closed for the entire lockdown period. Sources tell Global News the Premier calls it a circuit breaker, and it will also require all non-essential businesses to shutter across the province, and restrictions could be placed on outdoor activities such as skiing and skating. Medical experts believe stricter measures are needed to curb the spread of the virus.
Probably fines are what's needed. If the threat of, if reason doesn't work, maybe then enforcement is something.
The reality is, if no one ever left their house again, there would be no transmission. So we know logically that works. The problem is what is going to be the downstream effects of that.
The measures are in line with what the Ontario Hospital Association has been calling for to ensure that hospitals do not face a devastating surge in COVID-19 patients.
If we see that rejected by too many people, we will see, in all likelihood, a moment of historic difficulty in the month of January.
Meanwhile, Global News has learned that the Premier and his cabinet were considering asking for the provincial shutdown of all airports and to implement a province-wide curfew. In the end, those ideas were rejected. Morganne Campbell, Global News, Toronto.
We are also learning that the federal government is restricting travel from the UK as of midnight tonight. It's a move to stop the spread of a fast-spreading variant of the novel coronavirus. It was first reported in England last week. At least 6 European nations, including France and Germany, have already slapped temporary bans on travel to and from Britain. Here's Ross Lord.
In contrast to these scenes, people rushing into train stations to get out of town, day one of the London lockdown was marked by emptiness. Streets abandoned as new rules take effect, restricting the movement of more than 16 million people.
I think they're quite brutal, but I think it's to be expected. I think it's what's needed.
Because everyone's made plans and because it's this close to Christmas and then we're being told it's being cancelled, I think that's made it a lot more difficult.
A growing number of European Union governments are banning travel from the UK, all because of the new variant of the novel coronavirus.
The new variant is out of control and we need to bring it under control.
The new measures follow reports the mutation transmits up to 70% more than existing strains. A frightening number, but some infectious disease specialists in Canada are not convinced.
The key questions are, is this more transmissible? Does this cause perhaps a more severe illness? And will the vaccine work on this strain? And quite frankly, none of those questions have definitive answers.
Doctors say it's likely COVID-19 vaccines will be effective against the variant. Ross Lord, Global News.
The United States is concerned about an explosion of cases from holiday travel. Just look at what happened after Thanksgiving. The COVID-19 death toll is fast approaching 320,000 in the U.S. Today, trucks began delivering the delicate doses of Moderna vaccine. But as Jennifer Johnson reports, hospitals are still preparing for an overwhelming caseload in January.
Workers cheer as hundreds of boxes of the Moderna vaccine are loaded onto delivery trucks. One UPS truck driven by Todd Elbel, who lost his 78-year-old father to COVID-19.
I couldn't think of a better honor to do for my father than to do this today.
Billions of doses left the company's Mississippi plant, bound for hospitals and pharmacies across the country.
There is light at the end of the tunnel. There are now 2 vaccines that are approved. They are incredibly effective and efficacious.
The Trump administration's Operation Warp Speed is on track to deliver 6 million Moderna doses to 3,700 sites in every state this week, and another 2 million doses of the Pfizer-BioNTech vaccine.
We started slow. We're going to continue to increase. So the American people should be hopeful about vaccines, but we also need to remain vigilant.
Health officials are predicting the COVID-19 death toll will keep rising dramatically after the Christmas holiday. Travelers and celebrations causing another deadly surge.
It does seem to be the case that we're on track probably to peak in terms of the number of infections somewhere around the first week in January.
As federal officials try to speed up vaccination rates, millions of nursing home residents are facing delays as officials struggle to get consent forms signed, especially for those with dementia and Alzheimer's. Meanwhile, anxious Americans awaiting financial help from Congress are getting good news. Late Saturday, the Senate agreed to a coronavirus aid package, giving extra money to most taxpayers, the unemployed, and businesses struggling to pay their bills.
The great news is Congress is not going to be the Grinch. We're going to get this package done.
U.S. President Donald Trump is expected to sign the bill Monday, 5 days before unemployment benefits were set to expire for 12 million Americans. Jennifer Johnson, Global News, Washington.
Nunavut has reported the territory's first 2 coronavirus deaths. A resident from Arviat died yesterday after developing complications related to the virus. A Rankin Inlet resident also died yesterday after contracting the virus in southern Canada. It wasn't until November 6th that Nunavut reported its first confirmed COVID-19 case. It has since infected more than 200 people across the territory. A remote Indigenous community in northern Ontario has welcomed back its residents. 2 months ago, members of the Neshkandaga First Nation were forced to leave over water concerns. About 250 residents were transported from the Fly-In community to Thunder Bay, where they were put up in hotels. More work needs to be done to repair the local water treatment facility, and people there will still need to drink bottled water. But it's an issue that has persisted for more than 25 years. And as David Aiken reports, the community wants to know why it's taking decades to fix the problem.
An emotional day for the Neshkandaga First Nation.
Really happy, very happy, and glad to be home. Especially that Christmas is here and we need to be home.
Evacuated in October, the community is back after spending 60 days living in Thunder Bay, 450 kilometers away.
Here you go.
And even though upgrades to the community's water treatment plant is now producing water free of disease-causing bacteria, the boil water advisory remains in place because of continued deficiencies in the plant and distribution system.
It's not clean enough to drink. I just got the report of the test, and boil water advisory is still recommended, but we are getting very close to getting that lifted. Hopefully that will happen next year.
And so Neshkandaga continues to rely on boxes of bottled water shipped in to this Fly-In community.
We're just going to have to go with it, I guess, until we're told that it's okay to drink.
But the frustration remains.
I can only be as patient as I can.
I'm very frustrated, and I don't know. Sometimes I just feel like losing hope. What's the point? Are we supposed to live like this our whole lives? Is that what they expect of us?
Why did it take a quarter century to fix it? Or longer, Why? What does that say about our country? I mean, this is something that, that needs to be fixed.
And even when this 25-year-long boil water advisory is lifted, there will be a new problem: convincing people that their tap water is safe.
If we're able to get clean water here, I'm still not going to trust myself to drink the tap water because I've been growing up drinking water bottles and stuff like that.
David Aiken, Global News, Ottawa.
Coming up, Canada's other health emergency, the opioid crisis. "2020 has been a deadly year for the opioid crisis, particularly in Western Canada. Every month, BC's Coroner Service makes overdose data public. Now, Alberta says it will do the same, launching a new online tool. This year alone, the two provinces have recorded more than 2,300 overdose deaths. Global National's Heather Yerkes-West reports.
Canada's opioid crisis has killed thousands of people since 2016. But in Alberta, 2020 is proving to be the deadliest year so far.
We are in uncharted water when it comes to overdose. We have never lost as many people to overdose.
Between January and October, more than 1,000 people in Alberta died from drug poisonings. 904 of those deaths were related to fentanyl. That's more deaths than any other year since the opioid crisis began. Alberta's premier believes policies aimed at reducing the spread of COVID-19 are to blame.
The government suspended the operation of residential treatment centres and then reduced the number of people who could stay within them, and also suspended the operation of opioid dependency clinics.
In Alberta, these programs reopened in April after a brief shutdown in March. But Alberta's overdose deaths actually peaked in July, likely because of an increasingly toxic illegal drug supply.
When we look internationally, the UN Office of Drugs and Crime has looked at this issue. They're reporting that border closures have led to significant disruptions in illegal drug markets. And as a result, drug markets have become much more volatile during COVID.
Alberta is not the only jurisdiction seeing a rise in overdose deaths. BC has seen a record number of deaths this year as well. But while BC has looked at expanding access to a safe drug supply, Alberta's government is focusing instead on treatment and recovery, eliminating fees for residential treatment beds, but pulling funding for the opioid replacement program Susan Tierney's son has come to depend on.
I also believe that the program, the harm reduction programs that they're trying to shut down is not a good thing. They need all different avenues for the recovery, and that is one of them.
Alberta officials are now promising to update overdose data every month. With 2 weeks to go, 2020 already proving to be a deadly year for those struggling with addiction. Heather Yerkes-West, Global News, Calgary.
There's a new hotline in Canada to help in case of an overdose. The National Overdose Response Service is staffed by volunteers who have first-hand experience. The number can be reached 24/7. Still ahead, no country left behind. The calls for equal access to the vaccine. A 13-year-old boy in Nigeria is sharing details of the nightmare he endured when he was kidnapped from his school. The teenager was one of more than 340 boys taken by armed men on December 11th. He was reunited with his family last week. The terror group Boko Haram claimed responsibility, saying jihadists targeted the school because they believe Western education is un-Islamic. But police say local bandits wanting money were behind the abduction. There was another attempted kidnapping in the same area of Nigeria last night. Gunmen abducted more than 80 students, but police say they were returned by security forces after a fierce gun battle. Even before there was a COVID-19 vaccine, there were fears supplies would get snapped up by richer nations. Now that science has delivered, there are calls to make sure developing countries get those crucial doses. But as Reggie Cicchini explains, it's far from a fair share of this globally funded medicine.
The loss and devastation felt in 2020 is breathtaking. COVID-19 ravaged lives and economies on a global scale, but returning to a semblance of normal has its own obstacles.
One of the biggest threats to preventing this pandemic coming to an end is what's become called vaccine nationalism.
Rich nations provided billions of dollars to back vaccine research and wanted to guarantee a return on investment.
In just a few minutes, I'll sign an executive order to...
Earlier this month, President Trump called for all Americans to be first in line. It was largely symbolic, but the message showcases how wealth plays into this pandemic.
The pandemic is global, and the response has to be global.
To ensure vaccine distribution is equitable, the World Health Organization and two nonprofits backed by the Gates Foundation launched COVAX. It funded some vaccine candidates and was promised hundreds of millions of doses in return, an arduous effort to get 1 billion doses to 92 poor nations.
Now, the program is primarily about rationing better.
It's far from what's needed. Good enough for maybe 20% of that population, and it doesn't provide a way for poorer countries to get access to vaccine innovation.
We can afford to pay for the technology that will end the pandemic. What we can't afford is exclusivity and secrecy, limiting the available supply.
Some nonprofits like Oxfam are critical of countries buying their way to protection and using power as a bargaining chip.
We've seen already certain nations that want to extend their chessboard of geopolitics use vaccine diplomacy to try to get in the good graces of countries that can't get access to vaccines.
As vaccine production ramps up, so too do purchases. Several countries, including Canada, have procured more doses than they need. Ottawa, along with the EU, have signaled they may donate unused doses to COVAX. The U.S. is not a part of the program after President Trump withdrew from the WHO.
The more that the rich world locks up the supply, the harder it's going to be for COVAX to get enough doses to go to low and middle income countries.
The global community relied on each other to slow the spread of COVID-19. Now, health experts are cautioning without that same effort to eradicate it, far too many will be left behind or lost. Reggie Cicchini, Global News, Washington.
Up next, the bold move that has brought a new competition to the Olympics. The International Olympic Committee has declared breakdancing its newest official sport. It'll debut at the 2024 Paris Games. It's an effort to appeal to younger audiences. And as Mike LeCouture explains, the Canadian dance community believes it's high time breaking was on the world stage.
It's known as breakdancing, breaking, b-boying, or b-girling, but as of the Paris Summer 2024 Games, it'll officially be known as an Olympic sport. Including the athletic street dance is a clear example of the International Olympic Committee's goal to broaden the appeal of the Games.
Here we have had a clear priority, and this was to introduce sports which are in particular popular among the younger generations.
And it follows the pattern set for the Tokyo Games, which will see the debut of surfing, skateboarding, and sport climbing next year.
It makes sense. It makes complete sense.
Brian Tong has been dancing for decades. He challenges anyone who thinks that breaking isn't worthy of the Olympics.
People think that you just jump in and do these 1-2 step, but really there's lots of calisthenics workout that requires a lot of strength within breakdancing.
Now, when new sports are added, others have to be removed. So in 2024, both boxing and weightlifting will be pared down. Both have troubled governing bodies, and both are practiced predominantly by men, which makes it an easy choice for the IOC as it works towards gender balance in the Games.
Maybe there's consideration that if we do more diversity in our sports, younger target audiences, and more accessibility, we might get greater uptake by women athletes.
Breaking and how to score and judge it was hotly debated at the 2018 Youth Olympics in Argentina because it's not like gymnastics. There are some purists in the breaking community who worry putting the art form on a world stage could move it further from its urban roots. But many believe it can be like snowboarding, which didn't sell out just to be part of the games.
They're not approaching it to be accepted by the Olympics. We are hoping that the Olympics will take us in for what we are, and people will be able to see what it is.
And be able to see that breaking truly fits the Olympic motto of faster, higher, stronger. Mike Lecouture, Global News, Ottawa.
And that is Global National for this Sunday. I'm Robin Gill. We leave you tonight with Santa swimming with the fish. The Vancouver Aquarium held its annual Scuba Claws despite being closed. The show went virtual on social media, ensuring St. Nick can keep spreading holiday cheer underwater. Thank you for watching. I'll see you back here tomorrow. Have a great night.